Obesity is one of the greatest public health challenges of this century, and its prevalence has tripled in many countries in the WHO European region since the 1980s. During the COVID-19 pandemic, we have seen a tragic personal and public health impact, as people living with obesity have been more likely to experience severe outcomes from the disease, including intensive care unit admissions and deaths.
In the European Union, we estimate that obesity alone is reducing life expectancy by up to 4 years. And it's consuming approximately 7% of health budgets. It's important to note that lifestyle determinants are an aggregation of personal actions, but that they really depend as well on the choice environment. Even if persons are aware of what a healthy lifestyle should be, the way that products are placed in supermarkets, the poor nutritional content of canteen meals, and the lack of opportunities for physical activity really counteract any knowledge that people have. Initiatives which we hope to take at the European Union level will be based on improving consumers' information.
The major increase, I think, was during the 90s and perhaps early 2000 in most of the countries of the European region. We've had targets that are supposed to show that it would reduce by 2025 back to the level of 2010. No country is meeting those targets. We've had several government policies that we know are supposed to tackle obesity, but I think some of them have made an error in assuming that an individual can cut their own weight. Not on their own. It needs a surrounding supportive environment that does not promote high levels of junk food, that does not promote a lot of sedentary behavior, sitting watching screens. We need to change this environment if we're to change the obesity epidemic.
People with overweight and obesity have been heavily stigmatized and judged for many years. I know as a person living with obesity that I have a responsibility to what I eat, my physical activity. However, we know that obesity is a complex disease, and therefore it takes a lot more than just having a healthy diet and getting out and getting my 10,000 steps in a day. We are coming out of a pandemic where people have more mental health challenges, where they have not had access to their gyms perhaps, or been allowed to go for their daily walk. So therefore, we need to put priority on obesity treatment.
We need to bring together all stakeholders, governments, civil society, the private sector and others to change the trajectory of obesity in the region.